Ketamine use in mental health disorders. Mental health disorders. A mental illness is a condition that affects a person's thinking, feeling, and mood. Such conditions may affect someone's ability to relate to others and function each day. Each person will have different experiences, even people with the same diagnosis. Prevalence of mental illness. Approximately 1 in 5 adults in the U.S. experiences a mental illness in a given year. Approximately 1 in 25 adults in the U.S. experiences a mental illness in a given year that substantially interferes or limits one or more major life activity. Approximately 1 in 5 youth aged 13 to 18 experiences a severe mental disorder at some point during their life. For children aged 8 to 15, the estimate is 13%. 16.9% of adults in the U.S. had at least one major depressive episode in the past year. 18.1% of adults in the U.S. experiences an anxiety disorder such as post-traumatic stress disorder, obsessive compulsive disorder, and specific phobias. Among the 20.2 million adults in the U.S. who experience a substance use disorder, 50.5 to 10.2 million adults had a co-occurring mental illness. Common mental health treatments: psychotherapy, medications, case management, hospitalization, support groups, complementary and alternative medicine, peer support, and electroconvulsive therapy. Alternative treatment to mental illness. Ketamine. What is ketamine? Ketamine is a dissociative anesthetic which blocks sensory perception. Why ketamine? Ketamine targets neurotransmitter systems serotonin, dopamine, and norepinephrine, which are not effective for certain patients, usually those with severe depression. Treatments which are needed in order to relieve the suffering of those patients with treatment-resistant and treatment-refractory depression. The onset of action for most antidepressant medication impairs clinical utility and leads to frustration and prolonged suffering. Ketamine is classified as an NMDA receptor antagonist, having hallucinogenic and euphoric properties. Ketamine is very different from normal antidepressant medications. While most antidepressants work on the neurotransmitters serotonin and norepinephrine, ketamine focuses on different neurotransmitters called glutamate. Ketamine blocks the receptors critical for receiving glutamate signals, which improves the brain's electrical flow, resulting in reduced depression. Ketamine can also result in a state of dissociative anesthesia, making one feel a generalized sense of well-being. This anesthetic effect is why the drug is used for surgeries and unfortunately why it is illegal street use. Pros and cons. Ketamine helps people with depression by going to work on the mood regulators located in the human brain. As a result of the drug blocking these receptors, patients normally feel better within a matter of hours. Potential to help researchers identify a whole new line of medicines for fast-acting treatment of mental health disorders. Cons: greater physical risk as well as a potential for addiction or overdose. Not being legally put into the form where patients can administer it to themselves. Lack of long-term results and the prevalence of side effects. Routes of use: intravenous push or infusion, intramuscular, intranasal, and orally. Requirements for infusion: private room to minimize chaos and distractions pre and post infusion, cardiac monitor and intravenous infusion pump, nurse monitoring, psychiatrist prescribes ketamine, anesthesiologist oversees the infusion. Criteria for ketamine: referral by a psychiatrist, adults with moderate to severe depression, SI, PTSD, bipolar. Failed 3 to 4 adequate antidepressant trials. Patients who have failed different medication combinations, and/or ECT TMS. Most fail to respond to adjunctive group CBT or individual therapy. Criteria for ketamine therapy. Not required but common to most of the patients referred to the program. Chronic suicide ideations, multiple psychiatric hospitalizations and suicide attempts, disability or have been unable to work for several years to the symptom severity, chronic difficulty in managing mental health symptoms. Exclusions of ketamine. Substance abuse, history of psychosis, pregnancy, uncontrolled hypertension, previous negative response to ketamine. The sample information. 14 patients completed 3 ketamine infusions. 7.1 responded. After all 6 ketamine infusions, 41.7 of the participants responded and 16.7 remitted. 28 patients went bipolar who were treated over 3 weeks with 3 or 6 ketamine infusions in the recovery room of a routine ECT clinic. 41 patients with chronic PTSD treated with intravenous ketamine. 20 patients with major depression who randomly assigned, and 18 completed 2 treatment days with intranasal ketamine hydrochloride or saline solution. 41 patients with treatment-resistant depression of single infusions of ketamine and midazolam. Results of ketamine use. Results suggest that ketamine holds considerable promise as a potential rapid-acting treatment for patients at risk of suicide. Treatment with connected to minimal adverse reactions. If replicated, these results may lead to advanced approaches to the pharmacologic treatment of patients with major depression. First evidence for rapid reduction in symptom severity following ketamine infusion in the patients with chronic PTSD. Implications. Number of studies support the efficacy of ketamine as a rapid-acting treatment and suggest efficacy in bipolar depression, PTSD, and those with acute SI. Presently, clinicians and patients should be aware of the limited information available regarding optimal doses and long-term effects of ketamine treatment. Clinicians are optimistic and believe that ketamine has the potential to be a very important tool in the clinical treatment of severe mood and anxiety disorders. References. References continued.